For more on this, we're now joined by Profmed CEO Craig Comrie, who believes the absence of the NHI in the budget speech indicates that it has been relegated from the priorities for the coming years. Comrie says while a 28 billion rand allocation to the healthcare sector is a step in the right direction for basic service delivery, it does not represent progress towards implementing NHI in any meaningful way. Craig Comrie joins us now via our video link. Craig, thank you so much for your time this evening here on SABC News. First, overall, let's get just your perspective when it comes to the health budget and the allocation of 28 billion rand.
Yeah, it was in the main speech where NHI wasn't even mentioned once. You'd have to look deeper into the attached documents, the medium-term expenditure framework, to find references to NHI. And we see around 8 to 10 billion rand budgeted really for the setup and governance structures relating to NHI through direct and indirect grants. And so we don't see a real positive move in terms of implementing any type of services provided by the NHI. And so in our mind, we think that the budget and the pressures in the healthcare sector, particularly in the public sector, are going to be magnified by the fact that the USAID's funding have been withdrawn. Interestingly enough, that funding amounts to a similar amount, about 8 billion rand of funding that needs to be plugged. So we do think the move to try and support the employment of those young medical doctors is a very positive move. But we do need to see the almost 2,000 medical officer posts in the public sector trying to be funded. And that funding can be done through more efficient budgeting and certainly more efficient management of the public purse.
And when it comes to the NHI, I mean, you speak quite strongly when it comes to the NHI, really not featuring there a lot from the budget as we would have expected, particularly when it comes to how strongly the Minister of Health speaks about it. Would you say that for now it seems as if because of the issues we see in the courts, government decided, to put it on ice for now?
Yeah, there are lots of constitutional court challenges that are pending. And I think what we see now is certainly a Minister of Health who wants to push forward with the NHI, and the Minister of Finance stepping in through the budget speech, quite clearly indicating that until we know exactly what services are to be provided and what type of structure is needed, there is no additional funding for NHI. The initial estimates of NHI done even by the Department of Health in, more than a decade ago indicates an additional 200 billion rand needed. And if we know what 60 billion rand costs in terms of a 2% VAT hike, then we certainly would know what 200 billion or up until R1 trillion would be for the funding of NHI. So we see perhaps the finance guy stepping in and creating some realism behind the political promises of NHI.
And when it comes to, the US aid in which South Africa received, and, when it comes to now seeing where the budget stands, some have also welcomed the budget, saying that this will certainly help in covering the shortfall from PEPFAR.
Well, I think if you consider the shortfall, the budget doesn't actually mention any additional funding relating to the gap left by PEPFAR and USAID. So that still has not been clearly indicated anywhere in the budget or even the medium-term expenditure framework. So that will create an additional hole over and above what we've seen shared in the budget.
And when it comes to seeing, some of the healthcare sector workers being prioritized, for months we've been hearing, some qualified doctors who are without jobs, those also needed in various departments because of staff shortages in some of our hospitals and clinics. What does it say to the prioritization there when it comes to the healthcare sector and staff?
Well, we've seen this emerge over a long period of time now. So as much as the additional funding is going to help secure just over 9,000 health workers and 800 young doctors, the vacancy rates of that medical officer role in the public sector sits anywhere between 5 and 22%. So we actually need 2,000 young doctors employed, and that starts to give us or provides us a basis to just deliver what we should already be delivering in the public sector. So we actually need to move the number a lot higher. We probably need double that number to be employed. 3,600 doctors are qualifying every year. We need most of them to form the foundation in the public sector, and for that we need more efficient way in which we spend the healthcare budget. We not necessarily need the additional funding, but it is welcome to see the 28 or 29 billion additional funding to support that effort.
And looking at the budget overall and the issues around the NHI, which we saw being reverberated last year by the president and even, the health minister, would you say that at the moment, looking at, the spending of the country and of government, is it still a priority?
Well, I think that's one that's still open-ended. I think there's lots of water to flow under the bridge. What we see is there's no real funding for NHI services. So as of currently, the funding is made available to start setting up the governance structures and the board of NHI. And for that, they're going to spend anywhere between 2 and 8 billion rand a year. But that's before we actually see any NHI services actually being provided. So the suggestion from my side would be to take that money. For 2 billion rand, you could easily employ 4,000 medical doctors and start to beef up the public sector service as a way to start to attract. If you actually invest a little bit more into the public sector, you can start attracting private medical scheme paying patients into the public sector, and so attract on a voluntary basis additional funding into the public sector, and that will stand good and provide additional services to everybody in South Africa, not necessarily just those that belong to medical schemes.
Yeah. All right, Craig, thank you so much for your time and for your thoughts. So that is Craig Comrie. He is the CEO there of Profmed, just giving us his insight when it comes to the budget speech and the prioritization of the healthcare sector, also with a focus there talking about the NHI.